Welcome everybody to this Fuse Physical Activity pop-up workshop. Many of you have joined these before. This one is entitled From Science to the Real World, and how can we improve physical activity practices locally and nationally. And our key speaker today is Adrian Bauman from Australia. Next slide, please, Caroline. So these pop-up workshops are quite short, so hopefully we can squeeze them into your very busy day. Going to start with a very brief introduction from me. Then Adrian is going to talk for about 20-25 minutes, and then, as is normal, we're going to have more of a practice element to the workshop. And Ben Rigby is going to talk about some of the work he's been doing with Peter and others in Fuse. We've then got a very short Q&A, and then we're going to stop for a break. And then for those of you who have time, we welcome you back for a much more informal discussion and bring a cup of coffee with you. Next slide, please, Caroline. So, general rules of engagement. We're all far too used to these Zoom experiences now. If you can ensure that your microphone is muted and turn your video off, please. During the presentation and the Q&A, if you can type some questions into the chat box, and various people, including Caroline, are managing all of those, and we'll get to those when we get to the Q&A session. In the social, please do turn your video on, and if you want to ask another question, please just type question mark into the chat box. Obviously, we expect normal professional conduct throughout, and if you feel anybody's behaving badly, then please contact the host, Ruth Wilson. Next slide, please, Caroline. So many of you are members of Fuse, many of you know about Fuse. So Fuse is a centre of excellence in public health research in England. It's a virtual centre operating across the 5 Northeast universities. Each university contributes financially to the maintenance of Fuse. Its USP is translational research in public health. And almost all of our work, all of our research is working in partnership with policymakers and practitioners, and also has a real focus on working in partnership with the public and users. It's also the founder member of the NIHR School for Public Health Research. Next slide, please. So the aims of this Fuse Physical Activity Network is to build physical activity research capacity across the northeast of England, and to share knowledge and provide networking opportunities and support implementation of physical activity strategies. Activities, we have been going since about 2010. We normally do physical activity workshops in person, and we spread them across the region. So sometimes we might be up in the north in Newcastle area, and sometimes in Teesside, and across the region. But since we all went into this madness of lockdown and not travelling, we now do these pop-up workshops online. We're really looking forward to getting back to seeing each other face to face as soon as possible. I see somebody in the chat has just put something around, are we going to share the slides? And the answer is yes. So all of the slides and indeed the presentations are going to be recorded and made available afterwards on a YouTube section of Fuse, and we'll send you information about that. But the discussion and the informal stuff after the coffee break, that won't be recorded, so so that part is slightly different. Next slide, please. So back to the programme. So we're going to start with Adrian, move on to Ben, Q&A, break, and informal social and discussions. And I'd just like to tell you a little bit about Fuse. So Caroline, next slide, please. Fuse is the Fuse Physical Activity Working Group is part of Fuse, and these are the people who are involved and make it all happen. So Scott Lloyd is on the door, as it were, today. He's letting you all in, and he's one of our practice partners who we work with tremendously well and have done over many years. Louise Hayes, Ali, Nat, Nicola, Dave from Sunderland, Oliver Bell, and Caroline, who is doing a lot of the work for this particular one. And then, of course, we've got the main Fuse team who are also managing the pop-up workshop today: Ruth, Cheryl, Laura, and Mark. But the most important people are you. We're really grateful that you joined us today. So without further ado, can I please introduce you to our main speaker, Professor Bauman from Australia, who's going to talk to us about some of his fantastic experiences over many years in the world of physical activity. Over to you.
Good morning, everyone, and good evening. I'll try and share my screen, which I think is working now. And thank you for inviting me. We're doing things by Zoom, and I'm only sad that I can't meet with people to talk about issues, because it's better when we do it that way. I'm going to try and give you a few of my experiences of working in the interface between academia and policymakers, academia and practice, that probably positions my public health career for the past 30 plus years. I felt a little bit, though, that you're already doing a lot of good things, because there are perhaps 7 people that I've worked with for 120 years in England in total person time who are already doing this kind of stuff incredibly well. And many of them you will know, and many of the things I will discuss are already happening. You've got an integrated approach to physical activity. We embed and lose physical activity in obesity plans or sports strategies where the physical activity never materializes, and sometimes we omit it completely. You're also well advanced in guidelines, intervention, guidance, and local translation. So I'll give you a few perspectives on this challenge from my experiences on programs, on partnerships, and on evaluation methods. But any of the people over on the right-hand side of my slide, or many others that I don't know nearly as well as the 120-year group on the right, can give you great guidance in the UK. One of the ways of characterizing the problem is we're doing an awful lot of publishing about physical activity. Research has exponentiated, and the slope of increase in physical activity publications is substantially greater than obesity or tobacco smoking in the last 15 to 20 years. We're writing a lot about it, but if we look at the prevalence of physical activity, it's not changing all that much. And that's interesting to note, because this is true in every country. We're publishing more and more, and our prevalence rates are not changing. You've had a 1% increase over 4 to 5 years. That's not bad, but it's also still within the limits of natural variation. The one very interesting thing in your national data in England in particular is there's been a narrowing of the gender differential in physical activity participation in meeting guidelines. And I'm just wondering to what extent that is an effect of the This Girl Can integrated program between Sport England and Public Health England at the same time. I'm not going to talk about 2020 data because it's influenced by coronavirus, as you're aware, and we're all being less physically active than we were. I am going to talk a little bit about broad guidelines. And the framework that we're working on most of the time is the WHO framework. And it includes the 4 action areas of environment, society, systems, and people, We're now linking a little bit to the Sustainable Development Goals. Some that I've circled are actually very relevant to physical activity. And that gives us a renewal of our frameworks for thinking about communities and physical activity. We also need to think a little bit more in a syndemic way about physical activity and the rhetoric that it provides, because when we think about COVID, it's dominated everything in Australia. It's dominated absolutely everything that we do and think about. And we have a much milder pandemic than you do in England. But if we thought in a syndemic way, we would think that, well, we should be doing things about obesity and smoking because it worsens outcomes in people who have clinical COVID. And there may be benefits for being physically active, but there's good evidence that population activity has declined during 2020. There was even a huge outpouring of government documentation on the 27th of July last year in England, when Boris Johnson came out of hospital and said, I'm going to spend £10 million on an obesity strategy, mass media campaign, and here's my action plan. That hasn't quite materialized yet to any substantial degree, but it would be nice if it did, because it would be a way of dealing with this in a syndemic, a co-benefits kind of a frame. We've got targets that WHO suggests that link to the Sustainable Development Goals to reduce physical activity inactivity by 15% by 2030. No one's actually reporting against these targets. No one's saying, well, how are we going? And you could actually do that at the local level in England, because your Active People Survey, Now Active Lives, has a sufficient sample size to give you regional data in northeastern England. You could certainly be plotting your own trajectory against the physical inactivity reduction targets. When we developed the Lancet series in 2012, we said more of the same is not enough. And in many countries, we're still doing the same, and that's not good enough. What are the next actions we need? So I'm going to think a little bit about community physical activity programs, because that's what you're doing either in municipalities, in local councils, in health regions, or in towns and cities. One of the things about being old or having been around for a long time, I think they're the same thing, is that you see a cyclic history of health promotion, starting with the Ottawa Charter in 1986, reinventing itself as health in all policies, and a partial reinvention as Sustainable Development Goals. We came out of a health promotion movement, but we've really been going in an integrated way with the Ottawa Charter concepts of community action, of supportive environments, of engaging with health services, of engaging with the built environment for 34 years. That's quite a long time for a relative new area. So what we do is we keep on reinventing ourselves. Health in all policies came back 15 years after the Ottawa Charter with accountability, shared goals, equity-based approaches, governance and community-based structures in a whole of government and intersectoral approach, as the Ottawa Charter had suggested. And now we're doing that through the Sustainable Development Goals. So one of the things we need to do to keep ourselves interested and engaged is reinvent ourselves. And local physical activity programs are no exception. And I'm going to talk a little bit about some principles for how this might happen. What science does is it gives us guidelines, it distills the epidemiological evidence. Every 5 to 10 years, most national governments in high-income countries reproduces physical activity guidelines. Takes 2 years to do that, and then says, now we've done physical activity, let's get on and do some other guidelines. By themselves, guidelines don't increase physical activity. You need national and local implementation of programs and strategies across the life course, across settings and across sectors, and in partnership across sectors to make the guidelines meaningful in terms of population change. What do we need to do? The International Society for Physical Activity and Health, ISPA, put together a series of 8 recommended strategies just 3 or 4 months ago. This replaced the 7 strategies that we'd put together 11 years ago, just before ISPA actually started as a society. We had the 7 best investments. We added workplaces in the 8th. And the thing is, it doesn't matter which one you start on. If there's evidence in that space and you've got capacity in your community, that's the best one to start with. And the worst thing you can do is say, well, we've got 8 things we have to do. We'll take our budget and divide it into 8 equal pieces and give 1/8 of our budget to each of these initiatives, which in effect means very little will happen that's likely to be able to induce population level change. So you need to think where your program is in the evidence cycle. Is there efficacy that it can work under good conditions? Is there effectiveness evidence from the literature that says it works in real world settings? Is there evidence that it can be scaled up, that it's ready for implementation at scale, that in other words, the implementation strategies you will use are likely to work? And that's an important question to think about in thinking about any program. Oftentimes, politically, people will just take a program and go straight to scale without going through efficacy and effectiveness. But I would argue that you at least need some evidence that it can work under good conditions. And that has to be pretty strong evidence that can persuade other people. When we put a typology or a framework together about how we understand evaluating public health programs, we described, we tested efficacy, we replicated in other settings and tested effectiveness, and then we disseminated, moving from what gets peer review funded to what gets scaled up, working in partnership with communities, with local councils, with regional authorities. And the academic rewards are on the left, and the policymaker and practice needs are all on the right. So this is a bit of a disconnect and remains a disconnect in many places. It's also looking at the evidence stages, looking along the evidence stages in yellow, then changing to green. What the policymakers are interested in are what are the policy options shown by the width of these arrows? What can actually inform policy and programs, and how can we disseminate, and even better, after disseminate, institutionalize? Few things are institutionalized in physical activity. Perhaps physical education in schools might be an example, but very few other things are institutionalized. And again, we've got the dichotomy of academic rewards and policymakers' needs. But if we only do efficacy studies, we won't reach very many people or improve the health of very many. We need to move to more people. And this model helps describe where the concordant interests of academia and policymakers might live, which is in the green rather than the yellow. And we need to do thinking and co-creation in that space more often. But the benefit of any public health intervention is its efficacy or effectiveness factored in with its adoption, implementation, and reach into a defined community. If you've got 30,000 adults in your community, then your denominator is I want to reach 15,000 who are inactive or low active. I'll now turn to local and regional programs and give you some thoughts on principles and best practice. You might be doing a whole community intervention. I've invented one, Healthy Durham. There might be a Healthy Newcastle or a Healthy Teesside. Or you might be adapting or extending a national program locally, which means how are you going to make that program work well in your setting? Or you might be doing a local program in 40 schools or 50 workplaces in a defined region. Or you might be doing something completely new and unexpected. Now, this is going back to testing things, but if things really aren't working or are working only a little bit, just because it's statistically significant in the published literature, doesn't mean it's going to make a change when you take that program to scale. You might need to do something completely different. You need to decide if your program is a simple single intervention with a single setting. Is it a complicated program which has multiple components, or a complex program which has multiple streams of work across a community with multiple sectors and multiple outcomes. In planning for your program, there's an increasing usage, more in the UK than anywhere else, of using systems approaches planning to deciding what's the local systems map for making physical activity happen in my community. What are the public transport levers, the sporting levers, the community facilities, the local council, the health in the elderly engagement, the preschool facilities? Where are my leverage points? Where are the traffic jams? Where are the potential for buses? Where are the fields that kids could use? Where are the school facilities that could be used after school? And in your national policy in England, there are a number of stages and a number of settings. More of this in a second. The stages are really saying an active society means you need social change with sustained public education to make physical activity the normative way that people carry out their daily lives. You need professional to be enhanced, have their capacity built in primary care, and you're doing that in general practice in England and also in Scotland, much better than anywhere else that I know about. You need to scale up the evidence to fit diverse contexts. You can't just take a program and put it in a community and say it will work. How does it need to change? What things are going to fit best? And what effect can you expect from taking that program into that community? It might be socially disadvantaged. It might be rural. How will that differ from the setting where the program was tested in an efficacy trial? And active built environments, what does the evidence say about how we can design cities, design public transport systems to make activity more accessible to people? And the local strategic decisions, local priorities and local capacity are around what are your life stage settings you're going to target? What are your sectors that you'll engage with? Who are your community partnerships? And do you have any special groups that you want to target in your particular community or setting? Public Health England promises support for local action. There are evidence distillations, there is the NICE frameworks, there's some work on return of investment for evidence, although that's very difficult in a lot of these macro level evidence generating areas. There's a lot of online tools, there's best practice suggestions, but the concept of building partnerships with academia and with other agencies, building physical activity into clinical settings, doing professional education also need to happen. So thinking about the evidence for action when you're thinking about physical activity locally, first, what's published? What's in the peer-reviewed literature? What's in the grey literature? What worked elsewhere? It's usually been tried somewhere. And I think we need to demythologize the difference that it worked in Cornwall and therefore it couldn't possibly work in the north of England. That's probably not true. It could probably work in the south of France and it'll work in the north of England. It may not work in the north of England if it's been trialed in Kazakhstan or Mongolia, because that's rural space, wide spaces, very different and culturally different thinking about physical activity in countries at different levels of development. What evidence do you need for population health programs? What evidence will you accept? Those are the macro things. The local community things in brownie red color. How can you deliver the program in this community? What adaptations are needed? What costs will you incur? Can you afford that? What costs can you save by not doing absolutely everything? Will the program deliver outcomes similar to the initial evidence generating trial? In scale-up research, we call this the voltage drop when delivered at scale. In other words, how much of an effect size less will you get when you deliver a program at scale? And how will you evaluate your programs? For local programs, you need partners with the health sector, the local trusts, non-government organizations, charities, health professionals, other community groups, and perhaps the private sector, although I have some caveats about the private sector in a minute. But you need to then, with those partners, do your local program. You need to be evidence informed. You need to have some priorities and some recommended programs that you're going to invest in. Build a network and community of practice between your communities and between communities in the northeast of England and other parts of England, because a community of practice can save a lot of time in sharing good examples. Are evidence-informed programs adapted to the local context? What are those issues going to be? And in planning your logic model, you've got to specify those things. Will you have enough time to complete the tasks of rolling out the program in your communities, given its complexity? Will it be maintained for long enough? Will you have sustained staff and sufficient resources? Will it stop as soon as you take funding away from it, or will it have some self-sustaining evidence? And how will you evaluate its reach, number of participants, and effects on those engaged? My private sector caveat is we have to be careful of private sector engagement with big food, big soda. Alcohol supports a lot of funding of sport in Australia, even youth sports and kids sports and local sports clubs. We may need to ensure that your program is independent of private sector funding. Local implementation of global programs is a good idea, and Parkrun is a good example of that kind of thing that's well entrenched across the England and the UK. I'll tell you about something we did 20 years ago in a place called Wheeling in West Virginia with my friend Bill Rieger. This is a photo from January 2021, but the photo is about 15 years old, where we did a community-wide intervention in that community before we had any ideas of how to do this or the structure, but it was a complex program. We developed a local coalition, which is still going to this day, even though academics have withdrawn from the project. It had no national strategy or guidance. It got together hospitals and planning and sport and schools, long-term planning, informed by community-based participatory research with a social marketing campaign, building the infrastructure like the foreshores here and new bicycle ways and trails, measuring partnerships of all the engaged agencies over time, measuring the coalition and local leadership. And it was a partnership with West Virginia University, but wasn't led by the academics. It was led by the coalition itself. And it's an example which is still meeting, still continuing, and still building things in this little community called Wheeling in West Virginia. So these complex programs are difficult to evaluate. And I'm going to talk for a couple of minutes about evaluation before I wind up. The evaluator, whichever paradigm they come from, tends to bring their own values into the type of evaluation that's developed. Should it be quantitative? Should it be qualitative? And really it needs to be both, and it needs to be excellent, and it needs to be strategic. Ideally, it needs to use hybrid methodologies which promote better results. You need excellent qualitative research to understand how things work, and excellent quantitative research to measure, did things work? And I want to share with you something I was involved in quite recently that I'm just thrilled to have been engaged with, which is a piece of work led by David Ogilvie from Cambridge on pragmatic evaluation called, instead of building another brick in the wall, building a dry stone wall in terms of your program and its evaluation from stones of different sizes to make them fit into a coherent whole. And making sense of that is the evaluation logic model and planning task. So to conclude, last couple of slides, how can we improve physical activity locally and nationally? By using good practice, by working out if adaptation in local contexts is feasible. Will it produce useful effects? If not, go back to the beginning and plan and partner until it does. Don't just do it because you have to. They almost always don't succeed. Have you got a long enough time frame to produce the changes you hope for? From your logic model, do you know exactly what you want to change? Have you got enough resources to make that happen and measure change well? You use reflective evaluation to understand the mechanisms and quality population level evidence to persuade others that what you did really made a difference. And where you can, use comparable methods or measures across projects to actually compare different kinds of things. You've got a lot of nice guidance, but you're pulled in multiple directions. So sometimes you need to think outside the box. So to conclude, you need to use local data for your regions to actually determine if you're succeeding. You need other elements in your evaluation strategy, including your implementation indicators, monitoring your built environment, monitoring your partnerships to see if they're happening, monitoring schools uptake, monitoring workplaces. But above all, you need to innovate and build creative new stone walls, all of which have different shapes, different stones, but fit together and stay up for hundreds of years. Thank you.
Adrian, thank you so much. That was a really inspirational talk, and you got through so much information in a very short space of time. I love that, particularly the inferences to reinvention and innovation. We're going to pick up some questions, and I can see there's a lot that's come in. But before we do that, I'm going to hand over and ask Ben to present his work in collaboration with Peter and others. Very exciting work that he's been doing with practice. So Ben, thank you.
Thank you very much, Carolyn. I will just quickly share my slides with you all. Okay, those should be sharing now. Thank you very much, Carolyn, and of course, a big thank you to Adrian for joining us this morning for what I think was a very stimulating and really important presentation, actually. And as you'll see, what I talk about soon perhaps reflects some of the views here in the northeast of England. My colleague Peter apologises for not being available today, so I'm going to be talking to you today about 10 guiding principles to support knowledge exchange and implementation for physical activity. And I hope to speak, as I say, to some of what Adrian has discussed from our perspective. Oh, my slides are going. 1 second, there we go. And we're doing this to coincide with the publication of a new Fuse brief, which is available on the Fuse website for you to find out much more information about what I'm going to say. So today's presentation is based on a paper that we published with colleagues in Fuse Physical Activity Group a couple of months ago. We started from the premise that translating national policy, for example, evidence-based guidance, into effective local practice is undoubtedly a challenge. Now, we feel increased national policy attention, like Adrian, has not necessarily translated into effective physical activity programs for local delivery or substantial increases in population activity levels. We proposed that giving insufficient attention to the implementation context and limited interactions between policymakers, practitioners, and researchers might be responsible for this. So drawing on the views and experiences of participants at 2 previous workshops, we considered how this challenge may be addressed. The first workshop on the development of a combined research and practice agenda for Fuse stakeholders, and the second was one in which we explored how we as a region could best prepare for what were back then the new physical activity guidelines in such a way we could put them into practice. And then finally, using the Fuse knowledge exchange model as a guide, we reflected on this learning to develop a set of 10 key principles for physical activity policy implementation. And these are designed to be transferable for anybody out there looking to bridge the science practice gap in physical activity contexts. Before discussing the principles, I think it's important to briefly consider the key findings from each workshop, which map onto each other somewhat. And while I have presented some of workshop 1 findings before, I'm going to go over them again for those who weren't there. In considering a priority research and practice agenda then, so workshop 1, practitioners, policymakers, and researchers seemingly understood that the real world of promoting physical activity is complex and needs to be approached that way. It was perceived that traditional ways of doing research are perhaps not always fit for purpose or map on to how the real world of promoting physical activity operates in terms of time, scale, or practices. There was also a perceived need to address gaps in the knowledge and understanding of all stakeholders so they could better appreciate the work of each other and how they do it, particularly in terms of communicating and translating research in simple, focused messaging. From workshop 2, which focused on implementation planning, participants felt a broad culture shift might be necessary, one that reflected more participatory or action-oriented perspectives to research in particular. This, however, will add to the evident complexity we've spoken about today, not reduce it. Participants collectively felt that the impending physical activity guidelines, as was, presented a great opportunity for people and organisations from different sectors to convene and discuss what's important for our local and regional communities. Having these diverse groups in the room allowed physical activity to be prioritised at different levels, and the consideration of different relevant local policies and how best to communicate knowledge among networks in policy, practice and research. So on to the principles themselves. They're in no particular order despite being numbered. First, clearly participants felt a need to work with complexity rather than resist it. Policy and programme development is inherently complex. It involves many interacting parts coming together in ways that we can't necessarily predict. And these ideas are beginning to break through now in physical activity, but we must approach them with an equal measure of enthusiasm and critical reflection, I feel. Second, it's well known that people have different ideas about what constitutes good evidence. We as academics may produce something we think is a gold standard, but doesn't necessarily pass scrutiny elsewhere. We need to speak to people's values, beliefs, irrationalities, as well as social norms as much as we do to the rigours of science. Recognising that, therefore, we need a space to bring these viewpoints together. And traditionally, Fuse physical activity workshops have been a great opportunity to do just that. Moving online in the pandemic has allowed us to broaden our perspectives even more with views such as Adrian's from around the world. However, like Adrian, our participants at previous workshops agreed that physical activity prevalence rates remain stubborn and we can't keep reproducing the same old stuff. Leading on from what I've just said, it's important to take these perspectives on board and incorporate them, not just hear and listen to them. Creating multidisciplinary spaces in a way that Fuse physical activity workshops have done challenge people to think outside of their customary patterns of decision-making and evidence engagement. Moving on slightly, it's important that we're quite pragmatic and you react to what's happening around you, both locally and nationally. The Fuse Physical Activity Group has always been very receptive of people's ideas, allowing them to propose topics for workshops they think will be interesting and useful to partners. Topics such as policy and pregnancy, for example, have reacted to changes in the national policy landscape. And on this subject of pragmatism, run with the enthusiasm of your network. Similar to Adrian was saying about not investing all your money somewhere, you can still run with that enthusiasm. And while some Fuse Physical Activity Group members may be core Fuse staff, many of us are not. We do this in our spare time out of a passion and recognition of the need and importance of such workshops. Do not be deterred by a lack of resources. Start small and grow through the strength of your connections. Little pots of money and other resources come available as the importance, relevance, and indeed timeliness of your work becomes noticed. So I want to begin our last set of principles on the topics of messaging. It was quite clear that we need to make messaging much more accessible, using language that is suitable for a given target audience. And this is particularly important for researchers trying to engage in that policy practice space that Adrian spoke about, I should say. And I want to take this opportunity at the moment to highlight that there are some really great examples of work coming out around communicating evidence-based physical activity guidelines. If you're interested in that sort of stuff, have a look at the work of Chloe Williamson and others at Edinburgh for starters. Now, we believe that an effective network relies on inclusive lateral forms of leadership. In the Fuse Physical Activity Group, we don't have a leader per se in our network, but we do treat everybody's views as equal. And we always try to include a range of research and practice workshops. And this allows you as participants to see the connections firsthand about how academic ideas may play out in the real world. Having said that, leadership, it's still really important we have a clear vision. And participants felt that moving forward, the Fuse network may look beyond the ideas of targeted interventions in some respects, focus on how we come together to consider systems-based approaches and address determinants of health and inequalities in particular. I think this could be increasingly important focus for the North East as we try moving out of the pandemic, its effects on the physical activity engagement and our regional economy. And finally, the Fuse Knowledge Exchange model has demonstrated how we can maintain engagement beyond formal meetings. The pop-up workshops are just one example of how we've reacted to circumstance. Other things include research briefs, like I'm about to mention, as well as things like newsletters, embedded research roles, and capacity building exercises. So to finish, I want to draw your attention fully to the research brief that we've produced for today. It encapsulates what I've said and more in an easy, accessible format, and is available now on the Fuse website. We encourage you to download it, to read it, get in touch with any share any feedback with us. We'd really like to hear from you, and please share widely among your own networks. You may also be interested in reading our full paper, which is available in open access. So I'm very happy to take any questions alongside Adrian in the Q&A, and I hope that you found this brief presentation informative and useful. A very quick thank you to my co-authors, some of which are in the call, and everyone really, the whole Fuse group who've participated in any way in these projects. Thank you very much. I'll hand back over to Carolyn.
Thank you, Ben. That was fantastic and great piece of work, I think, that you and the team have done, and the Fuse brief in particular is a very accessible document, and so thank you for doing all of that.